Today we're going to go through our nose to tail exam. I know we've got 3 doctors here and we may do things a little bit differently, but we're giving them a full nose to tail exam. So specifically when we're looking at the eyes, looking in the ears, kind of go through some of those details on what we're doing. So I like to start out with the eyes and specifically just kind of looking for cataracts, other abnormalities back through the pupils, just making sure we're not seeing anything concerning like that. Going over to the ears next, just making sure we don't have any signs of infection or ear mites. And sometimes if they're here for an ear infection, we'll kind of get a deeper view of the eardrum itself, but if they're here for wellness, we don't tend to go that deep because sometimes it can be painful. I like to go to the lymph nodes next just because it's a kind of a nice transition from the ears down to the jaw. So looking at the lymph nodes at the front of the body here. I typically will go to the back lymph nodes very shortly after, but I like to finish up the face and look at the mouth before we go back. So in the mouth specifically, looking at tartar, we're looking for any loose tooth, potentially any painful teeth, looking back for any abnormal bumps or lumps, any ulcers. If you'll let you, we'll kind of get this mouth open and look at the roof, look at the tongue. Okay, good boy. And then we'll flip around here. Okay, so again, like to finish up our lymph node exam by feeling the back of the legs here, and then we'll kind of go up to skin. So specifically, we're looking for parasites, we're looking for fleas, we're looking for ticks, looking for any infection, looking for any redness. And then while we're in this position, I also like to kind of shift to the belly. We're feeling the intestines kind of slide through our fingers. We're making sure we don't have any belly masses, nothing abnormal. Okay. Then we kind of move on to the musculoskeletal system and then kind of continuing with skin, just looking for any bumps or lumps on the bones. This is a small breed, so I like to feel the patella, make sure we're not dealing with any patellar issues because they're very common to have luxations. Make sure there's no masses on the legs themselves. And then we'll kind of finish up with our listening. So we'll get the stethoscope out and, just for the sake of the video, not going to actually listen, but just kind of go through some of the positions. So what you may see us here is go through multiple positions. So we're actually listening to the different heart valves on the left side, and then we'll shift around to the right side, and then we'll actually kind of listen to multiple lung fields as well. So typically a few different lung fields on each side, just making sure we don't hear any crackles or wheezes or anything like that. So the other thing I wanted to address in this video is just kind of talking about the importance of annual wellness. And so we try to term that annual wellness, not necessarily annual vaccines. In my opinion, it's not the vaccines that are the most important thing annually. It's actually putting our hands and going through that nose to tail exam to make sure there's been no major changes in this little guy's medical history. The sooner we can kind of diagnose a problem, the better outcome we typically have. So, again, most important thing is starting with that annual exam. We hope you found this video helpful.
Be sure to subscribe for more questionable content from Dr. Andrew and Dr. Jen. Until next time.